Betrayal trauma is a deep psychological wound that occurs when someone we depend on for survival, safety, or emotional support violates our trust in a significant way. Unlike other forms of trauma, betrayal trauma comes not from external threats, but from the people closest to us, those we expect to protect us, love us, and stand by us. This type of trauma cuts deeply because it disrupts our basic sense of security and identity. It's not just the act of betrayal that causes pain, but the emotional dissonance and confusion that follows. Defining betrayal trauma. The term betrayal trauma was introduced by psychologist Jennifer Freed in 1991. She used it to describe the psychological harm that occurs when people or institutions we rely on for our well-being violate our trust or well-being. For example, a child who is abused by a parent, a spouse who is cheated on, or an employee who is mistreated by a trusted employer may all suffer betrayal trauma. Unlike other traumas, where the instinct is to run from danger, betrayal trauma creates a conflict. The victim may still need to maintain a relationship with the betrayer due to emotional, social, or financial dependency. This creates a confusing situation where the victim may suppress or ignore the betrayal just to survive emotionally or physically. Types of betrayal. Trauma. Betrayal trauma can take many forms. It is not limited to romantic relationships, but can occur in any close bond. Childhood betrayal. Trauma when caregivers or family members harm a child through abuse, neglect, or emotional abandonment. The child cannot simply leave, so the mind may suppress the traumatic memories to maintain attachment. Romantic betrayal. Infidelity, emotional manipulation, gaslighting, or abandonment by a partner. Since romantic relationships are based on trust and vulnerability, betrayal in this context is often deeply damaging. Institutional betrayal. When organizations, such as schools, religious institutions, or governments, fail to protect individuals or cover up harmful acts, they betray the trust of those they serve. Friendship or social betrayal. Being deceived, manipulated, or hurt by a close friend can lead to betrayal trauma, especially if the friendship was one of deep emotional reliance. Psychological effects of betrayal trauma. The psychological toll of betrayal trauma can be immense. Victims may experience a wide range of emotional and cognitive difficulties. Dissociation. The brain may disconnect from painful emotions or memories to cope with the betrayal. This can result in memory gaps or emotional numbness. Anxiety and hypervigilance. Constant fear of being betrayed again can make a person overly alert and mistrustful. Depression, feelings of sadness, worthlessness, and despair are common. Shame and guilt. Victims may wrongly blame themselves for what happened. Trust issues. After being betrayed, it becomes difficult to trust others, which can isolate the person and hinder future relationships. Over time, betrayal trauma can even lead to complex PTSD, post-traumatic stress disorder, especially if the betrayal was long-term or occurred during formative years. Why betrayal trauma is often hidden. One of the unique aspects of betrayal trauma is how often it goes unnoticed or unacknowledged. Victims may deny or minimize the betrayal in order to maintain their connection with the person who hurt them. This is especially true in situations of childhood abuse or in cultures where family and social image are prioritized over personal well-being. Moreover, societal pressure often makes victims feel ashamed of being betrayed, especially in romantic or marital relationships. They may fear being judged, not believed, or blamed. This silence only deepens the trauma, as the victim has no outlet to process their pain. Healing from betrayal trauma. Healing from betrayal trauma is a difficult but possible journey. It begins with acknowledging that the betrayal happened and that it caused harm. This validation is crucial for recovery. Therapy. Trauma-informed therapy, particularly methods like EMDR, eye movement desensitization and reprocessing, internal family systems, IFS, or somatic therapies can help individuals process the pain and reconnect with themselves. Self-compassion. Many victims internalize the betrayal as a reflection of their worth. Learning to be kind to oneself, rather than self-critical, is key to recovery. Rebuilding trust. Relearning how to trust, both oneself and others, is an important step. This often involves setting boundaries and developing healthier relationships. Support systems. Talking to trusted friends, joining support groups, or reading about others' experiences can be validating and empowering. Creating meaning. Some survivors find healing in using their experiences to help others or by creating something positive out of their pain. The deeper wound. What makes betrayal trauma so painful is not just the act of being